If you remember, the FDA standard to grant a vaccine emergency use authorization was 50%. Well, studies show Merck's antiviral pill is about 30% effective. And we found two things from our experts. One, there isn't a threshold for COVID medications, and even a 30% effectiveness could have a big impact on the pandemic. This month, an FDA panel took a look at Merck's newest tool to fight the pandemic, an antiviral in pill form.
The Merck pill interferes with the replication of the coronavirus.
Our source here, Dr. Joshua Sharfstein, a public health expert from Johns Hopkins University, explained a patient takes the pill after they get infected with COVID-19.
The medication basically inserts itself into that process so that the new viruses that are being made by your cells don't work anymore.
But according to the most recent data from Merck, it only reduces the likelihood of hospitalization and death by about 30%. Not nearly as effective as any of the FDA-authorized vaccines. So we wanted to find out, is there a threshold of effectiveness for COVID medications? Our source, Dr. William Moss from Johns Hopkins University, says no.
There's no kind of threshold that the FDA has set kind of for antiviral efficacy.
There is such a number that FDA put out there as a guidance for vaccines, but they did not do that for medication.
So we asked Dr. Moss, how does a treatment with a lower effectiveness help?
Here in the United States, we're continuing to have about 1,000 deaths a day. You know, even a 30% reduction in hospitalizations or deaths would have a major impact.
Sure, that would be 300 fewer deaths per day. All right, so the panel's recommended it. Is the FDA likely to approve it?
So that was the thing that we were kind of going on about, is that it was a slim majority of a panel that offered a recommendation to the FDA for emergency use authorization. Remember, we're not talking about approval, we're talking about emergency use authorization.
Gotcha. Okay.
It looks like the FDA could make a move in the next couple days or the next few weeks, probably before the end of the year, onto whether or not they'll allow this to be authorized to be used during the pandemic. But we'll have to see.
Okay, all right, thank you, Matt.